This is the room scan. That's my equipment. This is my client, physician's order. My computer is I only needed to place my phone. This is what I have over here. I'm not cheating or anything. Can you help me to time 1 for minutes? Please just look at that.
Okay.
Thank you. How many? How long?
It's time now. You still have time. I wanted to.
Okay, so it's already 4 minutes, so I'm going to start. Hello, my name is Jennifer. I'm a general assistant. I'm providing privacy. To be placing my hands, and I'm going to wear some PPE later on when I plug it in your hair. So, can you tell me your full name and date of birth, please?
Princewill, Ejogo, 0410, 1985.
Okay, do you have any allergies?
None.
Okay, so I'm checking your wristband and everything looks correct. This is the physician's order, and it looks like we're going to do a H2 assessment. And what that means is that I'm going to listen to your heart, your lungs, your abdomen, and everything that related to head to toe. Do you need to go to the bathroom?
No.
Need hearing aids, glasses?
No.
Do you have any concerns before we begin?
No.
Are you in a comfortable position?
Yes.
And this procedure is going to take less than 35 minutes. Your position is straight, your posture, and I would like to start asking you 3 questions, okay?
Okay.
For your own survey. I already looked at your health history that you applied to Schoology, and I'd like to ask you, like, when was your last visit?
4 months ago.
Do you have any change in your medication?
No.
Do you have recent falls?
No.
Okay. That looks good. Do you have any questions or anything? Concerns? Nothing?
No.
No? Okay. Everything looks good. What I'm going to do now is I'm going to sanitize my equipment. What I'm going to use, I'm going to use sanitize my stethoscope, my pen line, the horoscope, the blood pressure cuff. Everything is sanitized already. Do you have any preference in any of your arms for the blood pressure?
No.
No. Okay. So I'm gonna can you palm up? Alrighty. So feet on the floor, and this blood pressure cuff, it's good. It fits you. So this is the brachial, and I'm gonna help with the radial. So I'm getting your baseline. Okay, I stopped filling in at 120. And I'm gonna plus 30, so it's gonna be 150. So while we're waiting, I'm going to assess for level of consciousness, behavior. His speech is clear. He got good hygiene. His features are he has a smiling face. I don't see any, like, he's appropriate for he got good clothes for the weather. It's appropriate for the weather. And I'm going to assess for recent, immediate, and remote memory. So I would like you to remember these three numbers, okay? 257.
257. Okay.
Okay, so what color is the sky?
Blue.
What is your date of birth?
04/10/1985.
What do you have for breakfast?
I had tea.
How you got here?
I drove myself.
What are those three numbers?
257.
Okay, so the memory is intact. I'm also checking for level of consciousness. He's alert and orientated. He already told me his name and date of birth. Where are you at?
Southwest Tech.
Why are you here?
For head to toe assessment.
How you got here?
I drove myself.
So he's alert and orientated times 4 to person, time, situation. Okay, so it's time 4. Now it's already been 4 minutes. And I will also take your temperature. Can you open your mouth and close? .4. You take no more French. Now I'm gonna put my stethoscope on and get your blood pressure. Regularity 250. It's 480. So the blood pressure stages is within normal range. If it's more than 120/80, that means it's elevated, but right now it's normal, but if it's more than that, it's elevated. So now what I'm going to do is I'm going to put my gloves on. That's part of my PPE. Sanitize your hands, put my gloves on, and what I'm going to do now is I'm going to check the head. Head is big line, size is not big, not too small. I'm looking at the hair. It's short and it's curly and it's shiny and soft. I'm going to palpate the scalp for any masses of tenderness and no tenderness. Masses show no infestation, no hair loss or anything, no signs of that. I'm going to take out my gloves and I'm going to take my pen. Can you close your eyes? Close your eyes, please, and tell me where I'm touching you.
My forehead, my chin, my nose, my left cheek.
Okay. Cranial nerve 5, trigeminal is intact. Now can you smile? Can you raise your eyebrows? Can you puff your cheeks? Okay. So cranial nerve 7, facial is intact. Now can you stand up? Walk that way and come back. 10 feet that way and come back. I'm looking for the gate. Can you come here? Close your eyes. I'm going to check for your rubber test. Going to take like 20 seconds or 30. Please no falling. Be steady, doesn't need help. Okay, now can you bend your back? I'm palpating for inspecting and palpating the back for any. You're good. For any scoliosis, kyphosis, or lordosis, there's no sign of that. Now, can you rotate like this? Now do it again. Okay. So I'm doing the musculoskeletals, and I also palpating, inspecting. Now I'm going to check your temporomandibular joint.
Okay.
Now can you open your mouth? Close, open, move it side to side, protrude. I didn't hear any cracking or anything, it's intact. Now I'm going to do your shoulders. Can you put your arms above your head? Now internal rotation, external rotation. Now abduction, adduction, forward, forward, backward, rotation. Okay. Now for your elbows, can you flex, extend, supination, pronation. Okay. Now for your wrist, can you flex, extend, rotate. Now make a fist for your finger. Make a fist. Now expand your fingers. Abduction. Now put them together. Abduction. Now don't let me close them. That's muscle strength. Don't let me go down. Don't let me go up. That's muscle strength. And when I say it at the end, now can you face that way? And for this leg, can you put them forward, back, abduction, rotation. Now the same one on the other one, forward, back, abduction, rotation. Now for your knee, can you flex, extend, now for your feet, plantar flexion, dorsiflexion, inversion, exversion. Now the other side, plantar flexion, dorsiflexion, inversion, exversion. Now I'm going to take the muscle side. You show your shoulders. That's the trapezius, and that's the muscle strength. So trapezius. Now can you do this? I'm gonna check for the deltoid with resistance. Okay, that's the deltoid. Now I can do this. Bicep with resistance and triceps and muscle strength. Now don't let me go. Muscle strength. Okay, now you can sit down. Don't let me go up. Don't let me go down. Quadriceps, triceps, dorsiflexion, plantar flexion.
Oh my, what? Do I keep
It's
doing
fine.
that?
You didn't get me. Okay. Muscle size is appropriate for the client, and muscle strength is for resistance, and it's 5 out of 5. Gonna put it down. 5 out of 5. And the trapezius one, it was the cranial nerve 11 accessory, and it's intact. Cranial nerve 11 accessory is intact. Now already. Okay. So now what I'm going to do is I'm going to sanitize my hands. I'm going to put on some gloves. And what I'm going to do is I'm going to look at your eyebrows, at your eyes, your hair distribution, and it's equally your eyelashes. I don't see any drainage or edema. Your eye alignments, they're symmetrical. Looking at your iris is brown. It's round. Brown sides, symmetrical on both sides, and no lesions around. Now I'm going to look at your pupils. Your pupils are round and they are black. Pupil size are 4 on both sides, so that's normal, and they are the same size. And looking at your sclera, it's nice and white. I don't see any scratches or lesions. Now can you see conjunctiva? Now up. In conjunctiva, it's nice and pink, and it's moist. It's not swelling or anything. Your eyelids, upper and lower eyelids. Now I'm going to palpate. Can close your eyes. Palpate your external eye, your globes. Sorry, can you close it? Lacrimal ducts, no tenderness. I'm gonna check the temporal sinuses, maxillary sinuses. I don't see any edema, no excess drainage or anything. Now I'm going to do some tests. So I'm going to do the lights. Direct light and concentric light. So I'm gonna look at your eyes. Now again. They dilate and constrict at the same time. Now I'm going to check for accommodation. Now look that way to the picture, and now look at my pen and follow my pen. Eyes accommodate at the same time. They constrict and dilate at the same time, so that's good. Now can you read this?
Pupil guide.
So cranial nerve.
People gauge. Sorry.
It's fine. Cranial nerve, 3 oculomotor, 2 optical, 4 trochlear, and 6 abducens. I'm also going to check for the 6 cardinal gazes. So follow my pen. So 6. Now can you cover one of your eyes and let me know when you look straight, and let me know when you see my pen.
I see that.
Just look straight.
I see it. I see it. I see it.
Now cover your other eye and let me know when you see.
I see it. Yes. Yes. Yes.
Now 4 peripheral visions are intact. Cranial nerve, 3 oculomotor, 4 trochlear, 6 abducens, and 2 optic are intact. Now can you close your eyes? Close your eyes. Close one of your nostrils. Tell me what you smell.
Alcohol wipe.
Not the other side. What you smell?
Alcohol wipe.
So cranial nerve 1 olfactory is intact. Now can you face that way and close your eyes and rub your tragus, and I'm gonna whisper and tell me what you hear.
246.
Now the other side.
156.
Cranial nerve 8 acoustic is intact. Now moving on the nose. I'm looking at the external sides of the nose, and it looks symmetrical. It's midline, no deformities. And now I'm looking nasal cavity. Can you look up? I see that her distribution is equal. I don't see any bumps, pileups, bleeding, excess drainage, no masses. I don't see anything like that. And I'm going to palpate for deformities, no tenderness. And I already did the temporal sinus, like maxillary sinuses. Now I'm moving on to your lips. I'm looking at the externa, how they look. I don't see the skin condition is good. External mouth. Now I'm looking at your lips. They are moist, no crackings. The color matches the ethnicity. Can I see your teeth? They look nice and white. They have good condition. You have 28 teeth. I'm looking at the gums. They are nice and pink. They are not swelling. I don't see any bleeding. No bleeding, no swelling, no lesions. Can I see your mouth? I'm looking at your tongue. It looks nice and moist and rough. That's sublingual. I don't see any the floor of your mouth, I don't see any masses. It looks nice and pink. Now your buccal mucosa was nice and pink and it's moist. Can you say ah?
Ah.
Your uvula, it's midline. It's not big or small. And your tonsil, they are not enlarged. And I don't see any exudate on the tonsils. And if I would palpate the tongue, I would have my gloves and grab them with a piece of gas and palpate it on top, top, down, sides. And for the hard and soft palate, they are intact. I don't see any scratches or bleeding or swelling. And I will palpate it with 2 fingers inside, and I will palpate for any masses or tenderness. And I'm going to palpate lips. No masses or tenderness. Okay. Can you say light type dynamite?
Light tight dynamite.
In his already so that was cranial nerve 9 glossopharyngeal and 12 hypoglossal. They are intact. And for the gag reflex, I will put the compressor in the back of the mouth, and that will be the gag reflex. If it's intact, it will be the gag. So that's cranial nerve 10, the vagus. I completed all the cranial nerves. So now I'm going to move to your ears. I'm looking the outside. I don't see any light skin breakdown behind your ears. No. Your auricle, I don't see foreign bodies, excess of cerumen, drainage, bleeding, swelling. So I'm going to for your pinna, push your tragus, your mastic process for tenderness, no masses, no tenderness. Okay, now I'm going to grab the otoscope and I'm going to inspect. Well, I already palpate the ear. Inside that here. And for children, I pull back, down, and for adults, up and back. Looking inside. I see a little bit of cerumen. The tympanic membrane looks nice and pearl color. And the other side, double up. The tympanic membrane is a nice and gray pearl color. I didn't see foreign bodies. No drainage inside in my middle ear. Everything looks good. Do you have any concerns in your ears?
No.
No. Okay, so that looks good. No abnormalities. And I'm going to palpate your lymph nodes. Preauricular, postauricular, occipital, tonsil, submandibular, submental, superficial anterior cervical, deep cervical, posterior cervical, subclavicular. I didn't feel any enlarged lymph nodes. So that's intact. Now I'm checking the neck. I'm checking the skin of the neck is intact. I don't see any rashes, bruising, or anything on the skin. Going to palpate the trachea. Trachea is midline, no deviation. Now can you swallow? I palpate the thyroid. I didn't feel anything. So all looks good. No masses or tenderness around the neck or tracheothyroid. Sorry. I'm going to look for your GVD. Can you look that way? No, you look that way. It can be in the sitting position or on the semi-flat position. so I don't see any signs of that. Now I'm going to take off the gloves so I sanitize it. Now I'm gonna grab my stethoscope, and first I'm going to feel for that cavity. So with the feel of my stethoscope, go ahead, can you hold your breath? Good. I didn't hear any breathing sound in that cavity, so that's fine. Now what I'm going to do is okay, for the muscle strain, this one: sternocleidomastoid, trapezius, the deltoid, bicep, triceps, the hips, and the quadriceps. Okay, that's good. Oh, now can you take off your shirt, please? I'm going to assess the respiratory. I'm going to check for anterior and posterior diameter. So 1 to 2, that looks good. Now I'm going to, can you look that way? Going to check for tactile firmness. Can you say 99?
99, 99, 99.
I can feel the vibration. Now I'm going to check for chest excursion. Can you take a deep breath? So my hands went up and down at the same time equally. For the muscle strain, that was equally too, both sides, everything equal, everything good, no abnormalities. No signs of cyanosis. I'm going to listen to the lung sounds with that diaphragm. Can you take a deep breath? Turn in front. Now I'm going on the back. Can you turn that way? Take a deep breath. On the back. Now can you put your arms like this? Can you take a deep breath? So those are 3 and 3 on the sides, and I didn't hear any cracking or fluid in the lungs, so that's good. Okay, so now I'm going to assess your cardiovascular. So I'm looking at the precordium. I don't see any hives and thrives. Now is the final five. I'll pay your chest. Okay, so no hives and thrives, no vibration. The skin is nice and warm. Don't see any scars or previous surgeries. No. Okay, nothing. So I'm going to assess, listen to your heart. So angle of fluid. Go to the right for your aortic. Pulmonic. This is where S2 is best heard. The loudest. Herbs point. Tricuspid and mitral. This is the apex of the heart. It's mid clavicle. I'm going to listen for 1 full minute and take respiration. So it's 80 beats per minute. And the respiration was 16 within normal ranges. And for the S1, the loudest was the mutual and tricuspid. Okay, now can you take off your socks and lay your right head, please? So, and yeah, the pillow is a little bit down. And I'm also going to put you in the bed. So, can I sit all this like that? And GVD disappears. No pulsations. Okay, now I'm going to assess the skin. The skin, I don't see any bruising, rashes, or anything. And the color matches the ethnicity. It's nice and warm. I don't see any signs of edema. Let me see over here. No edema. The nails are, let me check for capillary refill. Less than 3 seconds, and the nails, the bed of the nails are nice and soft, and the shape is normal. Don't see any other abnormalities. Now for the toes, capillary refill, less than 3 seconds, and I don't see any abnormalities in the shape. The shape of the toenails are nice and smooth, and the shape is correct. So now I'm going to say the ABCD for the skin is asymmetrical, order, color, diameter, and evolving, and I don't see anything like that on the skin. And for the edema scale, +1 is 2 millimeters and rebounds immediately. +2 is 4 mm and rebounds 10 to 15 seconds. +3 is 6 mm and rebounds 1 to 2 minutes. And +4 is 8 mm and rebounds 2 to 3 minutes. And that is considered crossing edema or pitting edema, so I didn't see any. So no bruising, no rashes, no dryness. Let me check your skin triggers. It looks like you're hydrated. I don't see any like dehydrating under the eyes, right? So now I'm going to check for the abdomen. The abdomen size in bulging or those scars from previous surgeries. So the skin is intact, no stria, and the hair distribution is intact. So with the diaphragm, I'm going to start with the right lower quadrant, right upper quadrant, left upper quadrant, left lower quadrant. Bowels are intact. The bell, the for the arteries, aortic, renal, iliac, and femoral. And I didn't hear any brewing sound, so that's good. Now I'm going to palpate, study palpate, looking at that client's face for any muscle resistance, pain, tenderness, mass, and check for blood extension. Okay, so now I'm going to assess for the peripheral pulses, the temporal. I already assessed the carotid one at a time. The brachial, the radial, femoral is right here. Popliteal. I can go on the skin, but I'm going to say that I'm going. That's fine. So yeah, the popliteal. Dorsalis pterygius and posterior tibialis. The rhythm is equally on both sides. I didn't see any like more than the other one. It looks all good. And for the skin test, like up and down, and everything looks good. Is there anything else I can do for you? Have done?
No.
No? Okay, so this is, well, thank you for your time. This is your cat line. Head is in the lowest position, side rails are up, tables within reach, room is just for fall. Right inside, I clean my energy, cleaning all my equipment, and document us according to agency policy for any deviation of normal. Thank you. Bye.